Well, it's time for a national checkup. Tonight, our panel is shaping up to be an important one. At the table, doctors Danielle Martin, a family physician with Women's College Hospital, Samir Sinha, a geriatrician at Mount Sinai. Mike Evans is an associate professor of family medicine at the University of Toronto, and Jay Udell is a cardiologist at the Peter Munk Cardiac Centre. All here to talk to you about your health and the drastic, or some might say desperate, measures being considered to persuade you to get fit. Well, summer's here and there's no better time to get outside and get moving. And although most people have been told over and over again that exercise is the key to healthy lives, it seems millions of Canadians simply aren't listening. According to Statistics Canada, a staggering 48% of adult Canadians are considered inactive, meaning they have little daily exercise. Only 9% of Canadian kids aged 5 to 17 get a recommended 1 hour of exercise a day. Now, as a result, obesity rates are up. The numbers are like a punch in the paunch. In 2014, 20% of adult Canadians, that's more than 5 million people, were classified as obese. Add to that another 6% of Canadians aged 12 to 17, about 125,000 kids, who were also classified as obese. So, if we know now more than ever we need to actively fight the fat, why aren't we? Do governments need to develop inventive and inspiring campaigns to get Canadians active? Is it time for businesses to pay workers to exercise or reward those who do? It's an idea that's being considered. And what about our schools? Are kids being bubble wrapped by too many rules and safety policies that are preventing them from getting out and getting fit? Good questions. Time for some answers. Well, we've seen the statistics here that certainly sets the table for this discussion. I want to know, though, Danielle, I want to start with you. The message has been spoken loud and clear for decades. Get out, get fit, get healthy. It helps prevent so many other health issues. Why aren't we listening?
Well, I don't think it's that we're not listening. It's that saying things over and over, louder and louder, doesn't actually get people to change their behaviors when all of the incentives around us are aligning us in another direction. So if our workplaces and our cities and our homes are not set up for us to be active, if our lives are not set up for us to be active, it doesn't matter how much you tell us to get active, any more than it mattered when you could smoke in every restaurant and on every airplane when we told people smoking was bad for their health. So we need to try to figure out how do we move the incentives to align with the message that we're trying to get people to listen to.
Mike, you're nodding your head too, and I wonder this though, but you keep telling people, especially come from doctors, health officials, that it's good for people to go out and do this. I mean, is it just the design of our lives right now that works against the idea of getting out and getting active?
Yeah, I think so, Mark. I mean, I agree with what Danielle says, and I actually think you think we tell people all the time, but actually when you look in our clinics, our medicine is so siloed. So we talk about, Alzheimer's or cancer or heart disease or arthritis. So these are things that exercise is good for all of these things. Right. But I just had a medical student come into my office, just finished her training. Never once was she modeled prescribing exercise in her clinic and all the different clinics she rotated through. So I think it's actually, partly our part that we haven't sort of really counsel people on a one-to-one basis, because I think a lot of this stuff is about our kind of choice architecture or designing our environment, but I think we have to do a little bit better job of kind of personalizing that to the individual, and that's where our kind of clinical interactions can come into play.
Well, I want to pick up, you mentioned the word incentive, and you mentioned smoking as well. Now, we've seen as there was a sort of a societal change against smoking, and a disincentive when you raise the price of cigarettes. So let's talk about incentives, because this is an idea that is being considered right now. It's either paying people to exercise or rewarding them in the workplace if they do. What do you think about that idea?
No, there's actually some mounting evidence that's showing that if you actually give people an instant reward, so say, give them $1, or actually give them more, and then they'll actually more likely go to the gym, or they'll more likely participate in exercise. There's good evidence to show that. And in fact, you're actually starting to see some health plans in the United States where they're actually saying, we're going to cut your premiums overall, right. How much you pay for your health care, because we know, or we'll give you free gym memberships if you're part of the health plan, because they know that actually that generates the healthy behavior behaviors. And so, just as we were saying, we have to figure out how we model the lives we live to incentivize more exercise and participation.
Jay, what do you think about it? Because I know some people watching would think, come on, give me a break. You got to pay somebody to go out and exercise. But has it come to that we do need to find these incentives to get people out the door and active?
We're hardwired to like rewards. And especially if you are paid to do exercise or if you get credits to do exercise, I think most folks would say that they would be motivated to do so. There's been studies that show that if you randomize people, half of them getting rewards or incentives, the other half getting routine, just counseling, that there's about a 50% achievement in weight loss compared to about a 10% on the average. But the physicians, we're hardwired too. So I think we have to look at the motivations in terms of all the opportunities for counseling and for rewarding both the person who should be exercising and the person who should be prescribing the counseling, such that our society can motivate those people to get the right counseling and that they need to exercise.
Yeah, and you mentioned that the financial incentives, that they have paid off when it has come for weight loss, is for addiction as well. With the people who've been fighting addictions, if there's been some sort of financial incentive, that's helped them move or get off their addictions. So, and there certainly is some idea here that this could work if, I don't know if it would take businesses or governments, Danielle. What do you think? Who would need to get behind such an idea?
I think it's a little bit of both. I mean, if you think about what you want to do is make the right thing to do the easy thing to do.
Right.
And you also want to provide barriers to doing the so-called bad stuff, right? And so you mentioned taxes on cigarettes. So, how can we create, how can we make walking more pleasurable or cycling more pleasurable in our cities? That most of those are public policy decisions.
Right.
But how can we also provide disincentives for people to take their cars? Some of that might be the way that your business organizes its parking arrangements, or the way that it might subsidize you to take public transit, or organize going for a walk at lunchtime, or walking meetings, or whatever it is. So I think part of the issue is that no one institution holds the responsibility for this. It actually is a shared responsibility across all of society. So everybody's kind of doing one of these, right?
Yeah. I'm going to wait for you to come up with a solution, and so on and so forth. So one of the ideas that has been kicked around, this obviously tailored more for children, was in New Zealand, where they introduced a concept called remove the rules. And this was in playgrounds and in schools, where they said, our kids are being bubble wrapped, so let's remove the rules from this, allow the kids to go out and do what they want. And they actually showed, and this was in a grouping of schools, more kids were going out and getting active, and fewer kids were actually getting hurt, which is what we're typically concerned about as parents. That's something bad's going to happen to the kids. Jay, what do you think of that idea?
Make the healthier decision the easier decision to make. So if we're going to go to the grocery store and shop, put the sugary sweetened drinks or the high caloric foods on the higher shelves and put the healthier decisions on the lower shelves. My kids are always grabbing for things on the shelves, right? And I mean, the packaging as well is always very attractive. But if you make the healthy decision the easy decision, whether it be at the park, whether it be at the school, whether it be the grocery store, I think you'll see that people are more prone to decide to take the healthier decision.
Mike, are you concerned that our kids may be too bubble wrapped today, and that could create at a very young age, a disincentive for them to go out and get active?
Yeah, I think so. I mean, I think of two things. So I think of culture and risk perception. We moved to France for a little while when our kids were young. And I remember all the local people mocking us for our hyper-parenting, and there they were actually pushing the other way. Let your kid figure it out for themselves. And I think the risk perception is interesting. Like in our world, we're constantly pushed, there's an abduction or there's a horrible thing that's happened. That's when you're making your risk perception question, that's what you're basing it on. And you're not seeing the long-term risk of obesity and chronic disease for your kids staying inside. And we're so kind of failure averse as parents. So I do think this is a classic thing where it's a bigger kind of culture issue, and we have to kind of flip that. So when people see their parenting, they can sort of take all that into account and say, okay, I gotta stop bubble wrapping my kid and get him out there.
Now, you talk about staying inside, and I know a lot of parents are concerned that their kids are spending far too much time in front of a screen, me included. But here's another way that you can do. In the UK, they're doing the gamification. It's a program called Change for Life. And the US does a program, healthy program eating, called Food Hero. Go online and you get these sort of rewards for going online. You're saying, oh no, more kids, more. I can know where you're going with this.
Teach you how to do it on a screen.
Yeah, but if that's where the kids are, I don't know, Samir, what do you think about that?
No, I think, again, it goes on that idea that we respond well to rewards, right? So how do we actually make it easier to participate in these things, and how do we actually incentivize that behavior? So, I'm a big fan of the City of Toronto's bike share program.
Yeah.
And I became even more excited when I went on to check my account, and then they had all my stats. And they they said how many miles I had biked. They talked about how much gas I saved and what my bike time was. And even the lady on the phone the other day was saying, your bike time's improving. Good job. And I thought, well, I'm going to do even better now. So I'm racing more, I'm spending more time, I'm using the bike lanes, but that's because I'm incentivized, and that's as an adult. So I think we all respond to that in different ways, and how do we encourage more of that?
And Mike, you've got an approach, the back to basics approach, make your day harder. Tell us about that idea, because to me, the minute you say make your day harder, I'm thinking this is the disincentive, not the incentive. But what's your idea there?
It's not a great branding exercise. Well, it started, I had a large gentleman following me at hockey, and I had this sort of boot cast on my ankle. And so the only thing I could do was bike to meetings, and I think about how can I make my day harder? By the way, one of my patients took a picture of me and said, would you trust this man to be your doctor? As I'm bicycling around. And so what it is so Sidney Crosby's not our hero. The hero is the man or woman who's walking up the stairs while everybody's escalating. And we're just, when we look at activity, we think of the kind of Nike commercial. But in fact, the biggest parts of our activity are like active transport, how we're getting to work, moving around. Mark, in the 60s, 60% of us had active jobs. Now 75% of us are sitting knowledge workers, you know? And so we're just looking for you to sort of park farther away. Like if the family, you know how you drive around for 10 minutes finding that spot and it's like 2 feet closer, we just want them to park farther away and say, hey, make your day harder. And if they, you know, take a picture and put it on social media, we just did this experiment completely unfunded, and we had 10 million impressions in a day picked up all over the world. So it just shows you that people are kind of getting this because our society is all about the easy button. You know, it's all about the, you know, I can put up my shutters from my bed and I don't have to move, and that's what's, you know, sold. And I think we have to kind of consciously push back a little bit and just take the stairs, you know, have walking meetings, stand occasionally. And I think these things built into our day, that can make a huge difference rather than pushing, you know, the hour in the gym, which doesn't seem to last too long.
Danielle, what do you think on that one? Because it could be like parking further away, getting up, walking around your desk. Any other tips for people who are thinking?
I was struck by a recent picture I saw on the internet of a gym that was on the second floor. All these people in their shorts and running shoes taking the escalator up to go to the gym for 30 minutes. I mean, the absurdity of that, right? So this is that stuff that we talk to our patients about in family medicine all the time, right? Take the stairs, get off the streetcar or the subway one stop earlier, you know, park your car a little bit further away. If you have to drive to work, walk with your kids to school and keep your car parked near the school, so you at least get that 20-minute walk with your children in the morning or whatever it is. Look for those small changes that you can make, because fitness is not just for the ultra fit, and being healthy and exercising is not just for people who go to the hard body gym. It's for all of us to just move our bodies around.
Yeah, Jay, you agree with this, that perhaps if we make it look like extreme sports, that people think, I can't do that, and that's going to be their disincentive.
I mean, how many people have a gym membership and unfortunately it's just getting dust on their shelf, right? Like, I mean, you can control certain things. There's so many interests working against us to be at high again, to gain weight and be fat. If we can just take control of that little part of our day and make it a little bit harder, I agree. I think you can see that effect will happen over time. You'll see it over a year.
And I guess, Samir, you would say bike to work then.
Yeah, well, I had a patient today who was saying, well, I feel really bad. I'm not going to the gym. But I said, but you bike every day to work and you take the stairs. I said, you know, these are the choices that we can make. But I think part of all this comes back to even our education in schools, right? So I didn't get a lot of education about healthy eating. And now I regret that later on, going, if I only knew that way back when, I would have hardwired those decisions. Or if I knew how important exercise would be, or making my day harder from when I was young, that habit of parking a bit further away or always looking for the stairs would be ingrained. So I think we need to think about how we change the way we think from an early age.
And I think what they should do for schools is make this panel session required viewing.
Agree.
It's a good start, right?
While they're walking and watching.
Exactly.
I love it. Thank you all very much.
Thank you.
for your time tonight. We always like to hear your thoughts on our discussions. You can reach us at cbcnews.ca, The National.